Lindsey Smith, welcoming you to Raise the Line with Osmosis from Elsevier, an ongoing exploration about how to improve health and healthcare. We've spoken to many guests about the challenges of health communication in today's world of information overload, but none have the kind of expertise Tesfa Alexander has acquired in a career that has taken him from Madison Avenue to the halls of government and academia. From guiding tobacco education research at the FDA to leading public health initiatives at MITRE, Mr. Alexander has shaped behavior change programs that influence national policy and public understanding. He's currently the Deputy Director of the Lerner Center for Public Health Advocacy at the Johns Hopkins Bloomberg School of Public Health and an Associate Practice Professor at the university. We're going to tap his expertise to understand the key elements to effective health campaigns and how public health professionals can successfully communicate in a time of mistrust in science and government. Thank you very much for joining us today.
Thank you so much for having me, Lindsey. Great to be here.
I'd like to start with just learning a little bit more about you and what first got you interested in the field of public communication.
I think back to my days as being a youth and being really interested in the arts, from painting to airbrushing to poetry. And I went off to college with my mom wanting me to be an engineer and me saying, no, I really want to be a poet. And there was a bit of a tug of war there. And eventually neither of us won. She realized that engineering was something that I could do, but it wasn't a topic that I was passionate about. And I quickly realized that she had a good point, that being a poet wasn't going to lead to a fruitful career. So I went on to study organizational communication and writing. And moving on from there, from undergrad, going to graduate school to study organizational communication at Emerson College. And while at Emerson College, I had a variety of great internships in tech, internships in the educational space. And then I landed a job, not an internship, but a job basically to pay the bills by sheer coincidence at the Department of Public Health for the state of Massachusetts, where I was processing EMT applications. And during that time, my world was just exploded. My worldview was widened in a variety of different ways, and understanding public health and the aspect of what public health is and the great work that public health practitioners do. That up until that time, my understanding of health was just about the healthcare system, doctors, nurses, so on and so forth. And I had an introduction to public health at the Department of Public Health for the state of Massachusetts. And from there, realized that there's a lot of great work that's happening here. And there's an opportunity to combine my skills and interests with the experiences of the various public health practitioners that I worked with.
That's a great story. So aspirations of being a poet to getting into the communication space and then eventually landing in public health communications. So what are some of the core principles in health communication science, particularly as it relates to behavior change?
The core principles really is understanding who your audience is. And I'll talk about health communication science, but at the end of the day, it's really about marketing and effective marketing. When we think about marketing, typically in the general public, we think about the promotion aspect of marketing, and marketing as being the advertisements that you see, the sales promotions, so on and so forth. That is one of the 4 P's of marketing. And I actually like to talk about the 8 P's of marketing: people, product, partners, place, price, process, physical evidence, and then promotion. And it starts with the people at the very beginning, right? And so who is your audience? What's your overall goal? What are their lived experiences? And how do their lived experiences match with what your overall goals are? And that's a core principle of health communication science and effective health communication science. It's not just about messaging. Messaging is important, but that's a tactic. That's the approach that we use to help us achieve our overall goals. And within marketing and advocacy, public health advocacy, which is directly related to my role, is playing the long game. So successful health communication campaigns, successful marketing campaigns, successful advocacy initiatives keep the long game in mind, where you want to develop a long-term relationship with your target audience, the communities that you serve, or the policymakers that you're working with. And if you identify What are the things that are important to them? What are the goals and the values that they have? And how can you fit within their story, within their lives? Then you could be a lot more successful in your health communication science efforts or your marketing efforts or your advocacy efforts.
That's a really helpful P framework. Thank you for sharing that with us. So to put some of this into context, can you talk a little bit about the tobacco education efforts you were involved with and how you evaluate their effectiveness?
Yeah, definitely. I am fortunate to have had the opportunity to work within the Food and Drug Administration Center for Tobacco Products for nearly a decade and worked with a tremendous group of people, tremendous team, tremendous scientists, marketers, practitioners, stakeholders, the list goes on and on and on. And in that role, I led the Health Communication Research and Evaluation team, where we were responsible for all of the formative research as well as the evaluation of a number of national tobacco education campaigns. Those tobacco education campaigns range from educating youth about the harms of cigarettes and e-cigarettes to smokeless tobacco, as well as educating young adults about the harms of intermittent use of cigarettes and other tobacco products. And there's so many to choose from. The most notable campaign is the Real Cost campaign, and that campaign has a number of variations. And with that campaign and the campaign work, when I think about the success and the variations of the campaign, was primarily the flagship campaign that was focused on reducing use of cigarettes among youth. And within the first 2 years of that campaign, we successfully exceeded our goal, where over 500,000 youth were averted from smoking cigarettes. And importantly, we led to billions of dollars in cost savings in the healthcare system from our work. And we were able to evaluate or determine those outcomes from a number of evaluation studies that we had. And going back to my point before about playing the long game, where we were patiently tracking awareness of the campaign, attribution due to awareness of the campaign associated with changes in beliefs, and changes in beliefs, not just that smoking causes cancer or just smoking is going to cause you to die prematurely, but changes in beliefs that mattered to youth. So if you smoke, you would have wrinkled skin, or if you smoke, you are going to have yellow teeth or lead to tooth loss. And so you may ask yourself, why would we pick those messages? And that's because we found research that found that those were the messages that resonated with youth. As youth, you and they were not interested in the long-term health effects of smoking. They were interested in the cosmetic effects of smoking and how that might inhibit them from being attractive to a partner or their members of their peer group. And so from there, we were able to assess the impact of the campaign, changes in beliefs, and ultimately changes in behaviors, as well as the economic impact and savings for the healthcare sector in the long term.
Thank you so much for sharing that example. Incredible results. 500,000 youth were averted from tobacco use and then billions in healthcare savings there. My very first internship was with the Truth Initiative in Washington, D.C. back when I was in college. So this topic is really close to my heart.
Thank you for mentioning that. We learned a tremendous amount from the Truth Initiative and the work that they did. We very much stood on their shoulders and are grateful for them paving the path for us at FDA to be able to learn from their success to inform the Real Cost campaign, as well as from the success of others.
That's awesome to hear. I want to come back to something you said in your earlier response about storytelling. What role does storytelling play in communicating health information?
Storytelling is critical. Storytelling is to human as water is to fish. If you take into consideration how we process the world, how our worldviews are shaped, it's all through storytelling. Storytelling is in our newspapers, our media. Storytelling is religion. Storytelling is sports. Just yesterday was the Super Bowl, and the Super Bowl wasn't a report out of all the X's and O's, but a story around the redemption of a player, the story around the Super Bowl halftime show, and what does that mean or what does that not mean? Stories about everything in between the game, the commercials that we watch, and the discussion around those commercials. So if you take into consideration how story is all around us, story defines who we are, it shapes our worldview, it's really important to acknowledge the value of story in public health and in healthcare and what storytelling can do for us as a field. And at the end of the day, our goal as health professionals, whether it be in the healthcare setting or public health, is behavior change. And what leads to behavior change? Often it's emotion. It's not what we know, but it's what we believe and what we feel. And we've been taught historically that data and science move people to action, which is true in part, but data and science, they don't speak. Data and science don't have emotion. It's what we do with that data and science and translate that into a story that's relatable, that causes or encourages folks to think differently, to be motivated. And so storytelling is immensely critical. And what I would say, going back to the importance of health communication and not being focused on the promotion aspect of it in health communication and marketing, is the same thing applies to story. Often when we engage in story, we think if we tell a really good, compelling story, then that's going to move people to action. And I encourage folks to not start there. Start at the very beginning. Who is it that you're telling a story to? Whose story are you telling? We're drawn to character, not data, not science. Who's telling the story? So it's really important to make sure that you have a credible messenger, and then go into how are you telling the story. So the promotional aspect, the storytelling, the delivery comes last. What's really important is the strategic steps that I just outlined that comes prior to the actual storytelling to make sure that your story is in fact impactful.
Totally. And stories can be so powerful if delivered correctly. I want to talk a little bit about audience segmentation and cultural awareness in this work. How important is it?
Critically important. Critically important. I appreciate you asking that question. At the end of the day, if we try to reach everyone, we reach no one. And we see time and time again, whether it's in consumer marketing or public health marketing, the best approaches are the ones that take the time to appropriately segment their audiences, as well as understanding what are the social norms, the psychographics, the behavioral norms surrounding that audience. One of the things that I love to do is to eat. I love to be active and I love to eat. So hopefully they have some counteractive effects with one another. And when I think about my favorite food, there's poke, there's roti, which is a wrap from the Caribbean. I am Caribbean that has curry, etc. And then my other favorite dish is a dish called moussaka, which is basically a Mediterranean baked casserole that was introduced to me by a good friend of mine 2 decades ago when I was in Greece. And so you take into consideration those 3 different meals from 3 different regions of the world. If I were to walk into a restaurant and they were serving poke, roti, and moussaka, and they said, come in, this is the best poke, roti, and moussaka that you're ever going to eat, I probably would turn around. And that goes to segmentation, right? So if you take into account doing something really well and being able to really understand who someone is, you have to be focused. You have to tailor your approach, tailor your, not just your messaging, but your overall marketing strategy, your health communication plan to meet their needs, to meet the interests that serve them and what they're passionate about. At the end of the day, we need to move people to action and take into consideration moving people to action. If you develop a story and you don't understand what's important to them, then you're telling a story to the void. And you don't want to tell a story into the void. You want to tell a story to a person that appeals to them, that motivates them to action, and motivating them to action over the long term, not expecting immediate gratification.
So just to play that back a little bit, what I heard there was must have a tailored approach, must remain very focused, understanding what the audience is passionate about, and how do we move them eventually into action. Really important points there. So what are some of the strategies that help build trust in communities that may be skeptical of public health institutions?
Yeah. I'd say one of the first steps to building a strategy with communities that may be skeptical of public health institutions is identifying partnerships. I discuss the 4 Ps of marketing, which are product, place, price, and promotion. Those are the traditional 4 Ps of marketing. And my recommendation is that we expand those 4 Ps of marketing to include people, partners, processes, and physical evidence. And partners are critically important to answer your question. And partners should come very, very early in the process. And so the way we engage with communities who are skeptical and may rightfully be skeptical of public health institutions and health institutions is to engage partners who are a part of those communities to understand what is driving that skepticism and understand it and listen with a clear mind, listen to that skepticism judgment-free and understand why do they hold those beliefs. And our goal is not to change that person. Our goal is not to judge that person. Our goal is to understand why they hold those beliefs, why they may be skeptical, what are those barriers, and identify ways to overcome those barriers that address the needs that those community members have and that are working with them. So it's really critically important throughout our strategic planning and strategic execution at the very beginning that we have partners on board who represent the community and also who the community trusts and respect. And if we engage thoughtfully, intentionally with those partners, we can be tremendously successful.
Absolutely. Glad you mentioned partners in the community there. I think that's really important. And really building trust is really long-term work and takes a lot of consistency, humility, and a lot of listening along the way. So today we're seeing misinformation moving fast and it's sticking. I'm curious to know the approaches you've seen that actually kind of cut through that noise and help people sort fact from fiction in combating misinformation.
The approaches that I've seen have been focused less on combating information directly and working with the communities and the people with who are consuming that misinformation. And the reason why I say that and some color or thoughts around what I just shared is that we take in consideration the sheer volume of misinformation that is out there. And we, as a field, led a valiant attempt to directly combat that information. So let's try to match volume with volume. We know that now, looking back, that is a losing battle, that we cannot keep up with the sheer volume of misinformation, whether it be through social media, traditional media, or in interpersonal settings and sharing interpersonally. And so what we need to take into consideration in strategic planning is what are the available resources that we have and where can we be most effective? And what I strongly recommend is shifting our focus from combating misinformation head on, because I believe, and through evidence, what we see looking back, it's a losing battle. And how do we focus our time in and with the communities who we are seeking to serve and those who are disproportionately impacted by misinformation and working with them again to develop a long-term relationship. So it's teaching a person how to fish rather than fishing for them at the end of the day. If we work with communities to understand what their barriers are, their challenges are, the skepticism that they have around and for public health institutions, and work to acknowledge first, actually, before we acknowledge that skepticism, acknowledge their lived experiences, the stories that they're telling themselves. We tell ourselves stories every day about who we are. That's what we believe, and not try to counter that story, but just understand it. It will go a long way in helping us helping ourselves as a field of public health think less about us versus them or misinformation versus correct information and just develop a shared understanding. So at the end of the day, working with those communities so that they understand the benefits of the public health initiative, service, or product that we're providing in ways that are meaningful to them and their lives. And that's how we combat misinformation effectively.
I appreciate the way you frame that. I think it's really helpful to hear kind of what's working on the ground because so many people, including me, feel overwhelmed by the sheer volume of information coming at them on a regular basis.
I do as well. It's daunting to think about, and we know that there's still hope and there's still an opportunity if we refocus and shift our focus to the folks who are actually being impacted as opposed to the people who are sharing the misinformation.
Absolutely. So at Osmosis, we are a teaching company and we love to fill knowledge gaps. Is there a topic you think Osmosis should make a video about to fill a gap that is of particular concern or interest to you?
Yeah, thank you for that question. I would say, obviously I'm biased here, right? But the topic that we're talking about, thank you for the opportunity to share my thoughts on health communication science and marketing and the power of marketing. We often think about marketing within the field of public health. This is based on conversations that I've had with other professors, students, public health practitioners, is something that happens at the end of the game. This is what we do. Let's promote it. Let's figure out how to message it. And we could benefit from an understanding of the value of marketing and what marketing is from a people-centered approach and the value of strategic marketing. So my recommendation, and something that I'm personally pushing for, is that any and every public health professional or student, and every healthcare professional and student has a core understanding of the principles of marketing, the value of marketing, and how it applies to the work that they do, and more importantly, helping to support the communities that they serve.
That's a great idea, and we will definitely share that with our team. So you gave a little bit of advice to students and early career health professionals in our audience. I wanted to come back and ask if you had a little bit more advice for them about meeting the challenges of this moment and building a career in medicine.
My advice to them in meeting the challenges of their moment is that if we look back in history, we see trends and phases. I am a parent of 3 children, a 13-year-old, 11-year-old, and a 7-year-old. And the best advice that was given to me when I was early in my parenting journey, which I still am relatively early in my parenting journey, was that everything is in phases. And so where you may be tackling one challenge with a 2-year-old and then be tackling a new challenge with a 5-year-old, 7-year-old, 13-year-old, so on and so forth. Everything is in phases. And then I apply that to the challenges that we face right now as a field of public health and challenges that the members of the healthcare industry may be facing as well, is that this is not permanent. I truly believe, and if we look back and take a historical view at the funding booms and busts, if we look at a historical view of waves and challenges around trust with public health professionals as well as healthcare professionals, we see that there are, again, booms and busts and trends. And so the idea here is to play the long game, not get discouraged, and continue to focus on who matters to you in terms of the communities you serve and helping them address their needs, because in health and improvements in health and health quality is not going to go away. There's going to continually be a need. There's going to continually be a demand for the great work that we do, and encouraging folks not to get discouraged and continue to do the great work that you are doing despite the headwinds that we may face.
It's wonderful advice. Thanks so much for sharing that and for this entire conversation. Before we wrap up today's episode, is there anything that we didn't cover that maybe we should have?
No, you covered it all, Lindsey. I really appreciate the questions that you asked and the work that you all are doing to share the expertise of folks like me and others with your community.
Thank you so much for being with us today, Tesfa. We really appreciate it.
My pleasure.
And that brings us to the end of this episode of Raise the Line. A huge thank you to Tesfa Alexander for sharing his insights and helping us better understand what it takes to communicate clearly, credibly, and compassionately in today's health landscape. I'm Lindsey Smith. Thanks for checking out today's show. Remember to do your part to raise the line and strengthen the healthcare system. We're all in this together.
If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our episodes at osmosis.org/raisethelinepodcast.